is Dr. Szilárd Kiss. I practice at Weill Cornell, professor of ophthalmology and professor of genetic medicine. And the OPTIC trial was a phase 1 trial of anti-VEGF gene therapy. We think about anti-VEGF therapy for macular degeneration totally revolutionized our treatment approach. But the way we've been treating it hasn't changed that much. While the intervals may be extended a little bit, it's episodic treatment, like running on a treadmill. The concept of the OPTIC trial was to use the investigational gene therapy Ixo-vec and have sort of a one injection and turn the eye into a biofactory that makes aflibercept. And the eye would then make the aflibercept and control the disease activity. The OPTIC trial now has 5-year data, and it enrolled patients who were really highly treated patients requiring a lot of anti-VEGF therapy. Annualized 10 injections, diagnosed 3 years prior. Those patients received 1 injection of Ixo-vec and then were followed. There were rescue criteria, etc. And the top line is that at 5 years, the data looked consistent. Nearly 90% reduction in the annualized treatment burden, going from 10 injections a year to fewer than 1. So a couple of things, when you think about a phase 1 trial that was designed 7-8 years ago, we didn't know if the eye could be turned into a biofactory. We didn't know if the molecule that's being produced would actually be active. And we also didn't know the side effect profile. You're injecting billions of particles into the eye, the gene therapy is working, what's going to happen with the eye? And so obviously the efficacy stood out, but also the safety. So no new safety signals throughout the 5 years, no vasculitis, no hypotony, no inflammation that was not controlled initially. And so I think the combination of the aflibercept levels that remained constant and worked, and it appeared to be safe in this phase 1 trial, are all remarkable. Remarkably, they went from an annualized injection rate of about 10 to fewer than 1. Depending on the year, between 1.6 and 1.9 annualized injection rate. And so you're talking about something that really transforms the patient's need to come in, to go through your clinic, to get injected, and then to come back. And so in terms of what it actually did for the patients loved it because they didn't need to get that injection. What it did for the disease was controlled, even if you needed 1 or 2 injections, on average. So it's a phase 1 trial, and you have to interpret the results with that caution. It's hypothesis generating, and the phase 1 trial is going to enroll patients with a heavy anti-VEGF need. And that's why the patients, required a lot of anti-VEGF injections. They weren't treatment naive AMD patients, and they were really looking to decrease that treatment burden. And that's what we did. The phase 3 trials, which are ongoing, they're called AQUARIUS and ARTEMIS, are enrolling both types of populations. What do I mean by that? Treatment naive and treatment experienced patients. Now that we have some understanding of the potential for anti-VEGF gene therapy in AMD, we can expand that population more broadly. It could potentially be transformative. There's an old saying, if you knew what you were doing, it wouldn't be called research. But what we're looking for is a direct comparison to aflibercept given every 8 weeks. And to look to see if you can maintain the vision, maintain the anatomy with significantly fewer injections. And it would mean to the patients that instead of episodically giving you a shot and you running on a treadmill, your eye would control this chronic disease following 1 injection. Those are great questions. When we embarked on this path, we didn't know if you would make aflibercept for a year, much less 5. And so one of the parts of the results was actually doing anterior chamber taps to look to see if the eye is still producing aflibercept. There could have been that the disease just burned out after 5 years, but remarkably, the aflibercept level stayed pretty constant throughout the 5 years. And so that was something that was not obvious when we embarked on this path. And the eye does it safely. That also wasn't obvious in this, before we embarked on the phase 1 trials. potentially can be transformative. Obviously, you await the results of the phase 3 trials, but you think about the therapies that we are talking about, whether we're using or are on the horizon. We think about extending in maybe 1 month or 2 months. Now you're thinking about really decreasing that treatment burden, where for many patients it may be a one and done, depending on what the trial results are. And so I think patients are going to want this. They don't want to come to our offices. The family members don't want to bring them to our offices, and it can potentially be transformative.